You could be taking blood pressure medication you do not actually need, simply because of a mechanical mistake you are making at home. The number on your screen might say 150/90, but your true internal pressure might be a perfect 120/80, and the difference often comes down to a single physical error that confuses the machine. This is called fake high blood pressure, or pseudohypertension, and it is rampant among adults over the age of 60. I am Dr. Ben Harris, and today I'm going to walk you through the exact adjustments you need to make to ensure that the number you see is the number that is real. Most people believe that getting an accurate reading is just about buying a good machine and putting the cuff on the arm, but that is actually only the final step of the process. We are going to go through a checklist of corrections that will strip away the false numbers and show you your true baseline. 1. Support your back and uncross your feet to stop isometric hypertension. This is the single most common reason for a reading that is 10 to 15 points higher than it should be. It matters because your blood pressure monitor is extremely sensitive to muscle tension, even tension you do not feel. When your muscles are holding you upright, your heart has to pump harder to support that muscular effort, and the machine reads that effort as high blood pressure. Let me tell you about a patient of mine named Arthur. Arthur was 72 years old, and he was very diligent about his health. He measured his blood pressure every single morning without fail. He would wake up, walk to the side of his bed, sit down on the edge of the mattress, and put the cuff on his arm. Arthur was worried because his readings were consistently in the 140s and sometimes creeping into the 150s, despite taking his medication. He came to me concerned that his condition was worsening and asked if we needed to increase his dosage. I asked Arthur to describe his setup to me in detail. He told me he sat on the edge of his bed, which was quite high, so his feet did not quite touch the floor flatly. They were just sort of hovering or pointing down. Because he was sitting on a bed, there was no back support, so he was holding his upper body straight using his core and back muscles. I told Arthur that he was not measuring his resting blood pressure. He was measuring his exercising blood pressure. Sitting on a soft surface without a backrest forces your body to engage large muscle groups to keep you from falling over or slouching. This is called an isometric contraction. It is not like lifting a weight where you feel the burn, but it raises your vascular resistance significantly. Furthermore, because his feet were dangling, the blood vessels in his legs were slightly compressed by the edge of the bed, and gravity was pooling blood in his lower legs, forcing the heart to pump harder to circulate it back up. Arthur changed his routine the very next day. He moved his monitor to the dining room table. He sat in a firm wooden chair with a solid backrest. He placed both feet flat on the floor. He let his back fully relax against the wood of the chair. His reading dropped from 148/90 down to 128/82. Nothing about his health had changed. He simply stopped asking his body to work while he was measuring. This is simple physics. If your back is not supported, your diastolic pressure, which is the bottom number, can rise by as much as 6 to 10 points. If your legs are crossed, your systolic pressure, which is the top number, can rise by 2 to 8 points. If your feet are dangling, you are adding another variable of stress. Here is exactly how you should position yourself to fix this. Find a chair that has a hard, straight back. Soft sofas are comfortable, but they encourage slouching, which compresses the abdomen and can skew the reading. Dining chairs or office chairs are usually the best options for this. Sit all the way back in the chair so that your spine is supported from your hips up to your shoulder blades. You should feel like the chair is doing the work of holding you up, not your muscles. Next, look at your feet. Both feet must be flat on the floor. If your chair is too high, use a small footstool or a stack of books, but your feet must be grounded. Do not cross your legs at the knees, and do not cross your ankles. Crossing your legs squeezes the blood from the legs up toward the heart, which artificially increases the volume of blood in your chest and arms, raising the pressure reading. Keep your legs uncrossed and comfortable. Think of this position as the 0 point for your body. You want to remove every ounce of physical effort so the machine can see what your heart is doing when it is at total rest. This is easy to test for yourself. Tomorrow morning, try taking a reading on the edge of the bed, and then 5 minutes later, take a reading in a proper chair with back support. you will likely see a significant difference. This supports steadier readings and prevents panic over numbers that are not real. Before we move to the next item, I would like to know where you are starting from. Comment your age and your usual top number range below. It helps to see that you are not alone in trying to manage these numbers. Here is the next adjustment. 2. Wait for the vascular settle period before you press the start button. This is the timing secret I mentioned at the beginning. It matters because blood pressure is a dynamic measurement, meaning it changes second by second based on your movement. If you measure immediately after sitting down, you are capturing the pressure required to walk across the room, not your resting pressure. Let me share a story about Evelyn. Evelyn was 68, and she was a very active, busy woman who liked to get things done. She viewed her blood pressure measurement as just another chore on her to-do list, something to check off so she could get on with her day. She would tidy up the kitchen, wipe down the counters, walk briskly into the living room, sit down, slap the cuff on, and hit the button immediately. She did this because she wanted to get it over with. Her numbers were always high, often hovering around 160/95. She was terrified that she was on the verge of a stroke. When she came to see me, we looked at her history, and I noticed that her numbers in the clinic, after she had been sitting in the waiting room for 20 minutes, were actually lower than her numbers at home. This is the opposite of what we usually see. Usually, people have white coat syndrome, where anxiety raises their pressure at the doctor's office. Evelyn had home chore syndrome. I explained to her that when she walks, bends, or wipes a counter, her heart rate increases and her blood vessels constrict slightly to send oxygen to her muscles. This is a healthy, normal response. However, it takes time for the cardiovascular system to return to its baseline state after that activity stops. By measuring the second she sat down, she was measuring the tail end of her activity, not her resting state. I gave Evelyn a prescription that involved no medication. I told her she was forbidden from pressing the start button until she had been sitting in the chair for exactly 5 minutes. She had to sit there in silence, doing absolutely nothing. Evelyn found this very difficult at first because she felt like she was wasting time, but she did it. She sat for 5 minutes, looking out the window, letting her breathing slow down. When she finally pressed the button, her reading was 135/85, still slightly elevated, but drastically lower than the 160 she had been seeing. Over the next few weeks, as she got used to the routine, it dropped further into the 120s. The rush was adding nearly 30 points to her top number. For seniors, this settle period is even more critical than it is for younger adults. As we age, our blood vessels become slightly stiffer and less elastic. This means they do not adjust as quickly to changes in posture or activity. It takes a little longer for a senior's circulatory system to quiet down after movement. Here is how you need to do this at home. This is not just about sitting, it is about what you do while you are sitting. Go to your designated chair, the one with the back support we discussed in item 1. Sit down and check the time. You need to remain in that chair for a minimum of 3 to 5 minutes before you even think about inflating the cuff. During this time, you cannot be talking. Talking raises blood pressure because it requires cognitive effort and changes your breathing pattern. You cannot be scrolling on your phone or reading disturbing news. Emotional engagement releases adrenaline, which spikes pressure. You should not be watching an exciting scene on television. Ideally, you should just sit. You can close your eyes if you like. Focus on slow, gentle breathing. Do not deep breathe so hard that you are forcing it. Just breathe rhythmically. Imagine your blood vessels relaxing. Think of this 5 minutes not as waiting, but as part of the measurement itself. The measurement begins the moment you sit down, not the moment the cuff tightens. If you skip this rest period, you are essentially lying to your doctor about your blood pressure. You are presenting active data as resting data, and that can lead to over-medication. If you ever feel dizzy, lightheaded, or unwell, of course, do not wait. Check your pressure immediately or seek help. But for your routine daily monitoring, this 5-minute window is non-negotiable. This simple pause ensures you are treating your diagnosis, not your activity level. Let us move on to the next common error. 3. Empty your bladder completely before you approach the machine. This is a biological trigger that many seniors overlook, yet it is one of the most powerful drivers of false high readings. It matters because a full bladder sends a distress signal to your brain that directly constricts your blood vessels. Let me tell you about George. George was 75, and he was very rigorous about his morning routine. He wanted his blood pressure reading to be the very first thing he did, to be consistent. He would wake up, get out of bed, sit at his desk, and take his pressure immediately. Only after he recorded his numbers would he go to the bathroom to relieve himself. George noticed that his morning numbers were always the highest of the day. He assumed this was the morning surge that doctors talk about, where blood pressure naturally rises upon waking. While the morning surge is real, George was amplifying it artificially. He described a feeling of urgency while taking the reading, admitting that he often really needed to use the restroom but forced himself to wait until the measurement was done. I explained to George that he was stimulating his sympathetic nervous system. When your bladder is full, the walls of the bladder stretch. This stretching sends a signal through the spinal cord that activates a reflex. This reflex raises your blood pressure and heart rate. It is a survival mechanism. The body increases alertness when the bladder is full. In older adults, this reflex can be quite strong. I told George to simply swap the order of his routine. Step 1. Wake up. Step 2. Go to the bathroom and empty the bladder completely. Step 3. Wait a few minutes for the body to settle. Step 4. Measure. When George made this switch, his morning systolic pressure, the top number, dropped by an average of 12 points. He was stunned that something so simple could cause such a drastic fake hypertension. For someone taking blood pressure medication, a 12-point difference is the difference between increasing a dose or leaving it alone. Here is the science behind why this happens. The distension of the bladder wall stimulates the splanchnic nerves. This causes a release of catecholamines, which are stress hormones. These hormones tell the smooth muscles around your arteries to tighten. When the arteries tighten, the pressure inside them goes up. Once you empty the bladder, that signal stops, the arteries relax, and the pressure drops back to its true level. This is particularly important for men with an enlarged prostate, or BPH. If you have difficulty emptying your bladder completely, you might be walking around with a chronically full bladder, which keeps your blood pressure chronically elevated. If you often feel like you have not fully emptied, take your time in the restroom. Do not rush. Here is your new rule for home monitoring. Never take a reading if you feel even the slightest urge to urinate. If you sit down to measure and realize you need to go, stop. Take the cuff off. Go to the restroom. Come back, sit down, and restart your 5-minute rest period. Do not try to power through the measurement while holding it in. The distress of holding it in invalidates the number. This is a physical law of the body. A full tank equals high pressure. It is also important to ensure you are not constipated. While we are discussing the bladder, we must briefly mention the bowel. A full bowel can have a similar, though usually less dramatic effect. Straining to have a bowel movement can cause dangerous spikes in blood pressure, so if you need to go before you measure. Your body must be empty and comfortable. This ensures that the pressure reading reflects your heart health, not your bladder capacity. One more helpful note on this simple change is comfort. It is impossible to relax your shoulders and breathe slowly if you are clenching your pelvic floor muscles to hold urine. By emptying your bladder, you allow your entire pelvic region to relax, which signals the rest of your nervous system that it is safe to calm down. Most older adults can try this safely and see results the very next morning. This is easy on the joints and requires no new equipment. If you are enjoying these simple, practical tips, please consider subscribing to the channel for more senior-friendly health guides. Let's look at another hidden factor that bridges the gap between blood pressure and blood sugar. 4. Check your blood sugar if your blood pressure reading seems inexplicably high. This is the hidden bridge between the two most common conditions in older adults. It matters because high blood sugar changes the physical consistency of your blood and the behavior of your blood vessels. When your glucose levels are elevated, your blood becomes slightly more viscous, or sticky. Furthermore, high sugar levels impair the ability of your blood vessels to relax and widen, which naturally forces the pressure up. Let me tell you about Maria. Maria was 65 years old and had been managing type 2 diabetes for a decade. She treated her blood pressure and her blood sugar as two completely separate problems, with two separate doctors and two separate notebooks. She noticed a pattern where her blood pressure would spike to 150/90 on random afternoons, even though she had taken her blood pressure medication. She blamed stress, or the weather, or her machine. However, when she came to see me, we laid her two notebooks side by side. The connection was undeniable. Every single time her blood pressure was fake high, her blood sugar had been over 200 roughly an hour prior. I explained to Maria that she was seeing a vascular reaction to a metabolic problem. When there is excess glucose in the bloodstream, it draws water out of your tissues and into your blood vessels to try to dilute the sugar. This increases the total volume of fluid inside your veins and arteries. Think of a garden hose. If you turn up the water volume, the pressure inside the hose increases. Simultaneously, high sugar reduces the production of nitric oxide, a gas that tells your arteries to relax. So, Maria had more fluid volume trying to squeeze through tighter pipes. Once Maria focused on stabilizing her post-meal blood sugar spikes by walking after eating and reducing carbohydrates, her random blood pressure spikes disappeared. She stopped getting those scary 150 readings because she treated the root cause. If you have both conditions, or even pre-diabetes, you cannot ignore this link. Here is how you manage this connection. If you sit down to measure your blood pressure and get a reading that is unexpectedly high, do not panic and do not immediately take more blood pressure medication. Instead, check your blood sugar if you have a glucometer. If your sugar is high, that is likely the culprit. Wait for the sugar to come down, perhaps by drinking water or taking a gentle walk if safe, and then measure your pressure again. You will often find that as the sugar normalizes, the pressure follows. This prevents you from over-medicating your blood pressure when the real issue was a dietary spike. This supports steadier readings and helps you understand your body as a whole system. Since we are talking about this connection, I want to hear from the other side of our community. Comment your fasting number and your age in the comments below. It is helpful to see the range of numbers people are managing alongside their blood pressure. Now, let us look at a purely mechanical error that affects millions of readings. 5. Measure your arm circumference to ensure you are not using the wrong size squeeze. This is the most common technical error after posture. It matters because using a cuff that is too small for your arm will yield a reading that is falsely high, sometimes by as much as 10 to 15 points. Conversely, a cuff that is too large will give you a reading that is falsely low, hiding a real problem. Let me introduce you to Henry. Henry was 70 years old and a larger man, having been a construction worker in his youth. He had broad shoulders and thick arms. He was using a blood pressure monitor that he and his wife had bought at the pharmacy years ago. His wife was a petite woman with very slender arms. They shared the same standard cuff. Henry's readings were consistently alarming, often showing 160/100. His doctor was puzzled because Henry's heart sounded healthy and he had no other symptoms of such severe hypertension. When Henry brought his machine into the office to check it against our professional equipment, the problem was instantly visible. When he wrapped the cuff around his arm, the Velcro barely held. The cuff was popping open slightly as it inflated. I explained to Henry the physics of how these machines work. The machine measures the pressure required to collapse your artery. If the cuff is too small, the air bladder inside the cuff does not fully encircle the arm. This means the machine has to inflate to a much higher pressure just to squeeze the arm enough to reach the artery. The sensor interprets this extra squeezing effort as your internal blood pressure. We measured Henry's arm and switched him to a large or wide-range cuff. His reading immediately dropped to 138/85. He did not have severe hypertension. He had small cuff syndrome. The standard cuff that comes in the box usually fits arms between 9 and 13 inches in circumference. If your arm is larger than that, the standard cuff is lying to you. Here is how to check your fit today. Take a flexible tape measure, like a sewing tape. If you do not have one, use a piece of string and then measure the string against a ruler. Measure the circumference of your upper arm exactly in the middle, between your shoulder and your elbow. Do this on your bare arm, not over a shirt. Write down that number. Now, look at the cuff you are using. Usually printed right on the nylon fabric of the cuff, there is a range written in inches or centimeters. If your arm measurement falls outside that range, you need a new cuff. Most manufacturers sell separate cuffs in small, medium, large, and extra large that plug into the same machine. You do not need to buy a whole new monitor, just the accessory. Also, look at the index line on the cuff. Most cuffs have a white line or an arrow that tells you if the fit is correct. When you wrap the cuff, that arrow must fall within a specific zone marked OK. If the arrow falls outside the zone, the reading will be inaccurate. Ensuring the right fit is the only way to trust the math the machine is doing. This simple check prevents years of anxiety over numbers that are physically impossible to avoid with the wrong equipment. Here is another helpful step you can take to ensure accuracy. 6. Avoid the sodium spike window by timing your meals correctly. This is a timing error that catches people who measure their pressure in the afternoon or evening. It matters because sodium acts like a magnet for water in your bloodstream, and this effect happens relatively quickly after a meal. Let me share the story of Alice. Alice was 74 and lived alone. She preferred simple lunches, often opening a can of soup or heating up a frozen meal because it was easy and convenient. She was very disciplined and would measure her blood pressure every day after lunch, thinking that was a good, consistent time. Alice was frightened because her afternoon readings were always significantly higher than her morning readings. She would see 125 in the morning, but 155 in the afternoon. She thought her blood pressure medication was wearing off too early in the day. When we reviewed her diet log, the culprit was clear. Canned soups and frozen meals are often loaded with sodium to preserve flavor. A single bowl of soup can contain over 1,000 milligrams of sodium, nearly half the daily limit for a senior. When Alice ate that soup, the sodium entered her bloodstream rapidly. Her body, sensing the high salt concentration, pulled water from her cells into her blood vessels to dilute it. This increased her blood volume significantly within 30 to 60 minutes. By measuring right after lunch, she was capturing this temporary sodium flood. I advised Alice to change her timing, not just her diet. While we certainly wanted her to eat less salt, the immediate fix for her data was to stop measuring during digestion. Blood pressure naturally drops slightly after eating as blood moves to the stomach to aid digestion. This is called postprandial hypotension. However, in a high-sodium meal, the volume expansion can override this drop and cause a spike. Alice started measuring her blood pressure before lunch or waiting at least 2 hours after eating. The 155 spikes vanished. She realized her medication was working fine. Her lunch was just interfering with the test. Here is the rule for your routine. Never measure your blood pressure within 60 minutes of eating a major meal. The digestive process diverts blood flow and changes your heart rate, making the reading a reflection of your digestion, not your resting state. If you must measure after eating, wait at least 2 hours. Be particularly careful with hidden salt. Foods like bread, cottage cheese, and deli meats can have high sodium levels that cause this temporary volume expansion. If you have a meal that you know was salty, do not measure your pressure and scare yourself. Skip that reading and wait for the next morning. You know that the number will be artificially high, so there is no value in recording it. This helps you maintain a calm perspective on your true health trends. Most older adults can fix this schedule error instantly. If you are finding this helpful, a quick subscribe helps us reach more seniors with these vital tips. This leads us to the final and perhaps most surprising cause of fake high readings in seniors. 7. Hydrate your vessels to prevent the dry constriction effect. This is a paradox that confuses many people. They think, if water increases volume, shouldn't dehydration lower my blood pressure? It matters because in older adults, Dehydration often causes the blood vessels to clamp down tightly to maintain pressure to the brain, leading to a high reading. Let me tell you about Walter. Walter was 80 years old and he rarely drank water. Like many seniors, his sensation of thirst had diminished with age. He simply didn't feel thirsty, so he didn't drink. He would have a cup of coffee in the morning and maybe a small glass of water with dinner, but that was it. Walter's blood pressure readings were erratic. Some days they were low, making him dizzy when he stood up. Other days they were surprisingly high, hitting 160. He was on a roller coaster. I explained to Walter that his blood vessels were trying to compensate for his low fluid volume. When you are dehydrated, your blood volume drops. To prevent you from fainting, your brain sends a powerful signal to your arteries to constrict, to squeeze tight. This constriction raises the pressure. So, Walter was seeing vasoconstrictive hypertension. His pressure was high because his vessels were tight, not because he had too much fluid. Furthermore, when you are dehydrated, your blood is thicker and harder for the heart to pump. I gave Walter a water prescription. I asked him to drink 1 small glass of water every 2 hours, regardless of whether he felt thirsty. He set a timer on his stove to remind him. Within a week, Walter's readings stabilized. The dizziness upon standing, which was the low pressure, disappeared. The random spikes to 160, which was the compensation, disappeared. His pressure settled into a steady, predictable range. Here is how to apply this to your life. Do not wait until you are thirsty to drink. By the time you feel thirst, you are already slightly dehydrated. Sip water throughout the day to keep your vascular system full but relaxed. However, remember the rule from item 3. Empty your bladder before you measure. Being hydrated does not mean holding urine. It means your tissues are saturated and your blood volume is normal. A well-hydrated vascular system is a stable system. If you notice your numbers jumping all over the place, high one day, low the next, look at your water intake first. If your urine is dark yellow, you are likely dehydrated, and your blood pressure readings will be unreliable. Aim for a pale straw color. This simple habit protects your kidneys and your heart simultaneously. It is one of the easiest changes to make for better health data. 8. Keep your arm at exact heart level to stop the gravity error. This is perhaps the single most frequent mechanical mistake I see when patients send me photos of their home setup. It matters because blood pressure is basically a measurement of fluid mechanics. Gravity has a profound effect on the pressure of fluids in a column. If your arm is hanging down by your side or resting on a low table that is below the level of your heart, gravity adds weight to the column of blood in your arm. This makes the pressure read higher than it actually is inside your heart. Conversely, if you lift your arm too high, say, resting it on a high shelf or holding it up in the air, gravity drains the blood away, and you get a reading that is falsely low. Let me tell you about Robert. Robert was 76 years old and a retired engineer. He loved precision. He had a dedicated health station at a low coffee table in his living room. He would sit on his sofa, lean forward slightly, and rest his arm on the low table to take his measurement. The cuff on his upper arm was positioned about 6 to 8 inches below the level of his heart. Robert was constantly seeing readings in the 145/90 range. He was frustrated because he was eating right, exercising, and taking his medication. He brought his logbook to me, showing these stubborn numbers. I asked him to demonstrate his position. As soon as I saw him reach down to the imaginary low table, I knew the problem. For every inch your cuff is below your heart level, your blood pressure reading can increase by about 2 points. Robert was roughly 6 inches too low. That is a math error of 12 points added to his systolic pressure, simply due to the weight of the blood. I told Robert to abandon the coffee table. We moved his setup to his dining table. I instructed him to use a small cushion under his arm so that the cuff was exactly aligned with the center of his chest, right where his heart is. The very first time he measured with his arm at heart level, his reading was 131/82. The hypertension he was fighting was actually just gravity. Here is how you ensure this accuracy at home. Sit in your chair with back support. Place your arm on a table next to you. Your arm should be resting comfortably, palm facing up. Do not hold your arm up using your shoulder muscles. The table must take the full weight of the arm. Now, look at the cuff. The middle of the cuff should be at the same vertical height as your atrium, the right side of your heart. A good landmark is the middle of your breastbone. If the table is too low, do not slouch down to meet it. Grab a firm pillow, a folded towel, or a thick book. Place it under your forearm and elbow to raise the arm until the cuff aligns with your heart. This is critical. The arm must be supported. If you are holding your arm up in the air to get it to heart level, you are using muscle tension, isometric exercise, which, as we learned in part 1, raises your blood pressure. The arm must be dead weight on the table or cushion. This simple adjustment aligns the physics of the machine with the biology of your heart. It supports steadier readings and prevents you from treating gravity instead of your health. Here is another clothing-related mistake that acts like a trap. 9. Do not roll up a tight sleeve to create a tourniquet effect. This is a habit born of convenience that destroys accuracy. It matters because we are told to measure on a bare arm, which is correct. However, in the effort to expose the arm without taking off a shirt, many seniors roll their sleeves up tightly past the elbow. If that rolled-up fabric is tight, it acts exactly like a tourniquet. It squeezes the upper arm, compressing the veins and causing blood to back up and pool in the arm below the constriction. Let me share the story of Margaret. Margaret was 82 and very modest. She did not like taking her blouse off to measure her blood pressure in the mornings, especially in the winter. So, she would simply push her sleeve up as high as it would go. She was wearing flannel shirts that were not stretchy. The bunched-up fabric formed a tight ring right around her armpit and upper bicep, just above where the cuff sat. Her machine would struggle to get a reading, often giving her error messages. When it did give a reading, it was shockingly high, sometimes 170/95. She came to me terrified that her arteries were closing up. I examined her arm and saw a faint red indentation where her sleeve usually sat. I explained to Margaret that by choking off the venous return, the blood trying to leave her arm, she was engorging the arm with blood. The machine was trying to squeeze an arm that was effectively swollen with trapped blood. We made a new rule for Margaret. If she was wearing a long-sleeved shirt, she had to take her arm out of the sleeve entirely, letting the shirt hang loose on that side, or wear short sleeves for the measurement. She decided to keep a dedicated loose robe by her measurement chair. She would slip her arm out, measure on truly bare, unconstricted skin, and then get dressed. Her numbers dropped by 20 points instantly. The blockage she feared was not in her heart, it was in her sleeve. Here is the rule for your wardrobe. Ideally, wear a short-sleeved shirt that reveals the upper arm without any rolling. If you are wearing long sleeves, checking the fit is easy. Roll the sleeve up. Can you easily slide 2 fingers underneath the rolled-up fabric without it feeling tight? If the fabric is digging into your skin even a little bit, take the arm out of the sleeve. Or, measure over a very thin layer of clothing. While the gold standard is bare skin, modern studies suggest that measuring over a single layer of very thin, smooth fabric, like a dress shirt or thin blouse, is better than rolling up a sleeve and creating a tourniquet. However, never measure over a thick sweater, a jacket, or a coat. The machine cannot hear the blood flow through thick fabric. Prioritize the freedom of blood flow above all else. This ensures the machine is reading your arterial pressure, not the pressure of your laundry. Now, let's talk about a mistake that happens when you are trying to be social. 10. Maintain absolute silence, no talking and no listening. We touched on this briefly in the rest time section, but it deserves its own specific focus because of how powerful the social reflex is. It matters because speaking raises your blood pressure by 10 to 15 points immediately. But here is the catch. Listening to someone else speak also raises your blood pressure. Let me introduce you to James and his wife, Clara. James was 79 and Clara was his caregiver. She was incredibly supportive and wanted to ensure he did everything right. Every morning, while the machine was inflating on James's arm, Clara would stand next to him and ask, "How are you feeling today, dear? Did you sleep well? Does the cuff feel too tight?" James, being a polite husband, would answer her, I'm fine. It's a bit tight. I slept okay. They had a full conversation during the 60 seconds of the measurement. James's readings were consistently hovering in the hypertensive crisis zone around 180 over 100. He was being considered for a third blood pressure medication. When I observed them in the clinic, I saw this dynamic immediately. I explained that talking requires cognitive effort and alters breathing. Even more importantly, when someone asks you a question, your brain engages the orienting reflex. Your attention spikes, your heart rate lifts slightly, and your pressure rises to help you formulate an answer. It is a micro-stress response. I gave Clara a specific job. She was the guardian of silence. I told her that once the cuff was on, the room had to be a sanctuary of quiet. No questions, no comments, no eye contact that demands a response. James was not allowed to speak, not even to say, "ouch," or "it's done." They tried this strict silence the next morning. James's reading came in at 150 over 90, still high, but 30 points lower than his talking pressure. Combined with the other fixes we discussed, he eventually got down to a safe range without extra pills. Here is how you enforce this at home. Tell your family members or anyone in the house, "I am taking my pressure. Please do not speak to me for 3 minutes." Turn off the television. Turn off the radio. Do not answer the phone if it rings. If you have a pet that demands attention, put them in another room for a moment. Even active listening, nodding your head while someone talks to you, uses brain power that spikes pressure. You need to be in a state of passive wakefulness. You are awake, but you are not engaging with the world. This is the only way to get a true resting baseline. This is easy on the joints and costs nothing, but it requires discipline. If you enjoy learning about these hidden triggers, a quick comment below helps us know which tips are working for you. Let's move to a factor that changes with the seasons. 11. Warm up the room to prevent cold snap constriction. This is a biological survival mechanism that works against you during a measurement. It matters because when your skin temperature drops, your body's immediate priority is to preserve heat for your internal organs. To do this, it constricts, tightens the blood vessels in your skin and extremities. This shunts blood to your core, which is good for survival, but it drastically raises the pressure in your arteries. Let me tell you about Beatrice. Beatrice was 81 and lived in a drafty older house. She was budget conscious and kept her thermostat low in the winter to save on heating bills. She typically took her blood pressure in her bedroom, which was the coldest room in the house in the morning. Every winter, her doctor would notice her blood pressure creeping up. She would be put on higher doses in December, and then in July, she would start feeling faint because her pressure was too low. She was trapped in a seasonal cycle of over-medication. When Beatrice told me she often shivered a little while waiting for the machine, the light bulb went on. I explained that a cold room can raise systolic blood pressure by as much as 30 mmHg in seniors. Seniors have thinner skin and less muscle mass to generate heat, so the cold affects them faster. I didn't ask Beatrice to heat her whole house, as I knew she was on a fixed income. Instead, I asked her to wear a warm cardigan or wrap herself in a blanket for 10 minutes before the measurement. However, remembering the sleeve rule, she had to keep the arm used for measurement warm but accessible. She started sitting near a small space heater for 5 minutes before measuring. She made sure her feet were in warm slippers, not on the cold floor. Once her body temperature normalized, her vessels relaxed. Her winter hypertension disappeared. She no longer needed the extra winter dosage. Here is your checklist for temperature. The room should be comfortable, ideally around 70 to 75 degrees Fahrenheit if possible. If the room is cool, dress warmly. If your hands are cold to the touch, your reading will likely be high. Warm your hands under warm water or rub them together before you sit down. Cold hands are a sign of peripheral vasoconstriction. Also, check the temperature of the cuff itself. If you keep your monitor in a cold closet or near a window, the cold plastic cuff against your skin can cause a startling reflex that spikes pressure. Keep the monitor in a room temperature drawer. If you have diabetes, connecting to our micro niche, this is even more critical. Diabetes can affect the nerves and vessels in the extremities, making them harder to regulate in the cold. Ensuring you are warm is a safety step for your circulation. Most older adults can try this safely by simply using a blanket. Now, let's look at a chemical trigger that many of us love too much. 12. Time your caffeine intake to avoid the stimulant error. This is a hard one because coffee is often part of the morning ritual, right alongside the blood pressure check. It matters because caffeine is a potent vasoconstrictor for many people. It blocks a hormone called adenosine, which keeps blood vessels wide and relaxed. When adenosine is blocked, vessels narrow and pressure rises. Let me share the story of Thomas. Thomas was 69 and a retired truck driver. He lived on coffee. He would wake up, brew a strong pot, drink 2 mugs while reading the paper, and then measure his blood pressure. He believed that because he had been drinking coffee for 40 years, he was immune to its effects. His readings were consistently high in the 150s. He argued that this was just his normal state. I asked Thomas to do an experiment for me. I asked him to measure his blood pressure before his first sip of coffee for 1 week. The results were undeniable. His pre-coffee readings averaged 128/80. His post-coffee readings averaged 154/92. The coffee was adding 26 points to his top number. While he may have had a tolerance to the jittery feeling of caffeine, his blood vessels were still reacting to the chemical. In seniors, the metabolism of caffeine slows down, meaning it stays in the system longer. I did not tell Thomas to quit coffee. That would have made him miserable. I told him to change the order of operations. Step 1, wake up. Step 2, bathroom, item 3. Step 3, hydrate with water, item 7. Step 4, measure blood pressure. Step 5, enjoy the coffee as a reward. By placing the measurement before the stimulant, Thomas got a clear picture of his heart's actual health. Here is the rule. Do not consume caffeine, coffee, black tea, green tea, energy drinks, or certain sodas within 30 minutes to an hour of measuring your blood pressure. The same rule applies to nicotine. If you smoke, you must wait at least 30 minutes after a cigarette before measuring. Nicotine causes immediate sharp spikes in blood pressure. Measuring right after smoking is measuring a toxic event, not your baseline health. If you simply cannot measure before your coffee, wait at least 4 hours after drinking it to allow the peak effect to wear off. This supports steadier readings and lets you enjoy your morning ritual without guilt, as long as the timing is right. This brings us to the final strategy, the one that mathematically eliminates almost all errors. 13. Ignore the first reading and use the average rule. This is the golden rule of home monitoring. It matters because the very act of the cuff squeezing your arm can cause a mild startle response that raises your pressure. The first reading is almost always the highest reading of the set. Let me tell you about Linda. Linda was 71 and very anxious about her health. She would take one reading, see a high number like 145/90, and panic. She would immediately rip the cuff off, assume she was in danger, and call her daughter. She never took a second reading because she was too afraid of seeing the number go even higher. I explained to Linda that the first reading is like a practice swing in golf or a warm-up pitch. It gets the body used to the sensation of the squeeze. I made her promise to take 3 readings, 1 minute apart, and to completely ignore the first one. When she tried this, her pattern was clear. Reading 1, 148/92. She felt the squeeze, got anxious. Reading 2, 136/86. She knew what to expect, breathed through it. Reading 3, 132/84. She was bored, relaxed. Her true blood pressure was not 148. It was the average of the last 2, roughly 134/85. By ignoring the first reading, she realized she was much healthier than she thought. Here is the protocol you must follow. Sit down and do your 5 minutes of quiet rest. Take the first measurement. Look at the number, write it down if you want, but mentally discard it. Wait 1 full minute. Sit quietly. Do not talk. Do not move. Take the second measurement. Wait 1 full minute. Take the third measurement. Now, take the average of the second and third readings. That average is your medical reality. Most modern machines even have a setting that does this automatically. Look for a switch that says average or ma'am. If your machine does this, use it. If not, do the math yourself. This creates a buffer against anxiety, mechanical errors, and momentary spikes. Conclusion. We have covered a tremendous amount of ground in this guide. We started with the physical foundation, getting your feet flat on the floor and your back supported to stop the floating feet error. We learned the importance of the 5-minute vascular settle period to let your system quiet down after chores. We discussed the biological triggers, emptying the bladder to stop the full tank pressure and checking your blood sugar to ensure high glucose isn't thickening your blood. We fixed the mechanical traps, ensuring your cuff fits your arm size, keeping your arm at heart level to fight gravity, and never rolling up a tight sleeve. We addressed the environmental factors, keeping the room warm, maintaining absolute silence, and timing your meals and caffeine to avoid chemical spikes. And finally, we learned to hydrate our vessels and average our readings to find the truth. If you implement these changes, one of two things will happen. 1. You will discover that your blood pressure is actually much lower than you thought, saving you from unnecessary worry and potentially unnecessary medication. Or 2. You will get a truly accurate high reading, which gives you and your doctor the solid data you need to make life-saving decisions. Either way, you win. You are no longer guessing. You are measuring. Remember, high blood pressure is a silent risk, but fake high blood pressure is a noisy distraction. Clear the distraction so you can focus on your true health. If you have experienced any of these fake high triggers, let me know in the comments. And if you know someone over 50 who is constantly worrying about their numbers, please share this video with them. It might just save them from a lifetime of worry. Subscribe for more simple, research-backed blood pressure and blood sugar tips. I'm Dr. Ben Harris, and I'm rooting for your health.